egg freezing and embryo cryopreservation techniques and clinical uses. Egg freezing, oocyte cryopreservation, and embryo cryopreservation are assisted reproductive technologies, (ART), that allow for the preservation of fertility. Both techniques involve freezing eggs or embryos to be used at a later time. These techniques are increasingly used in fertility treatments, as well as for medical and social reasons. While both egg freezing and embryo cryopreservation involve the same basic principles, they are distinct procedures with different clinical uses and benefits. Here is a detailed explanation of each technique and its clinical uses. Egg freezing, oocyte cryopreservation. Egg freezing is a process in which a woman's eggs are collected, frozen, and stored for future use. Unlike embryo cryopreservation, which involves freezing fertilized eggs, embryos, egg freezing preserves eggs in their unfertilized state. The egg freezing process. Ovarian stimulation. The woman undergoes hormonal treatment to stimulate the ovaries to produce multiple eggs. This is similar to the ovarian stimulation process used in IVF. Hormonal medications such as FSH, follicle stimulating hormone, and LH, luteinizing hormone, are used to encourage the development of multiple follicles, which contain eggs. Egg retrieval. Once the eggs have matured, they are retrieved from the ovaries in a procedure known as aspiration or egg retrieval. This is typically done under sedation or local anesthesia and involves using a needle to aspirate the eggs from the ovaries. Freezing. After retrieval, the eggs are frozen and stored in liquid nitrogen. At this stage, the eggs are frozen in a state known as vitrification, a fast freezing process that minimizes ice crystal formation, reducing the potential damage to the eggs. Storage. The frozen eggs can be stored for years and can be thawed and fertilized later, either through IVF or ICSI, intracytoplasmic sperm injection. Clinical uses of egg freezing. Preservation of fertility in women with medical conditions. Cancer treatment. Women undergoing chemotherapy, radiation, or other treatments that may impair fertility often choose egg freezing as a way to preserve their fertility before treatment. Endometriosis or ovarian disease. Women with conditions like endometriosis or ovarian cysts that may impact their fertility may choose to freeze their eggs for future use. Social egg freezing. Age-related fertility preservation. Women who are not ready to have children in their 20s or 30s may choose to freeze their eggs to delay pregnancy while preserving the quality of their eggs. Fertility declines with age, and egg freezing offers a way to retain younger, healthier eggs for future use. Ovarian reserve assessment. Some women may choose egg freezing after receiving poor results from ovarian reserve testing to preserve eggs for future use when they are ready to have children. Embryo cryopreservation. Embryo cryopreservation involves freezing embryos after fertilization, allowing couples to store embryos for future use. This technique is commonly used in conjunction with IVF or ICSI, intracytoplasmic sperm injection, where multiple embryos are created and the best quality embryos are transferred to the uterus while others are frozen. The embryo cryopreservation process. Ovarian stimulation. Similar to egg freezing, the woman undergoes ovarian stimulation to produce multiple eggs. These eggs are then retrieved from the ovaries. Fertilization. The retrieved eggs are fertilized with sperm either via traditional IVF or ICSI. In IVF, sperm is added to the eggs in a petri dish, while in ICSI, a single sperm is injected into each egg. Embryo culture. The fertilized eggs, embryos, are cultured for a few days, usually for 3 to 5 days, to allow for development to the blastocyst stage, day 5 embryos. The embryos are carefully monitored for quality during this period. Freezing. The embryos that are not transferred immediately are frozen using the vitrification process. This fast freezing method minimizes damage to the embryos by preventing the formation of damaging ice crystals. Storage. The frozen embryos can be stored for years, and when the woman is ready for a pregnancy, the embryos can be thawed and transferred into the uterus. Clinical uses of embryo cryopreservation, fertility preservation, cancer patients. Embryo cryopreservation is commonly used for women undergoing cancer treatments that may affect their fertility. After ovarian stimulation and egg retrieval, embryos are fertilized and frozen for future use. Fertility preservation in women with reproductive health. Issues. Women with conditions like endometriosis, polycystic ovary syndrome, PCOS, or those at risk of early menopause may use embryo cryopreservation to safeguard their fertility. Embryo banking. Multiple IVF cycles. For women undergoing IVF, multiple embryos are often created during a single cycle. Extra embryos that are not needed for the immediate cycle can be frozen for future use, reducing the need for ovarian stimulation and egg retrieval in future cycles. Genetic screening. In some cases, embryos are frozen after undergoing pre-implantation genetic testing, PGT, for conditions like aneuploidy, cystic fibrosis, or other genetic disorders. Only healthy embryos are then selected for transfer. Successive pregnancies. Embryo cryopreservation allows women to have multiple pregnancies from one IVF cycle, reducing the need for repeated egg retrievals and ovarian stimulation. Donor egg or sperm use. In cases where a woman is using donor eggs or sperm, embryos are often created and frozen. The woman may use the frozen embryos for future IVF cycles, which can be beneficial if she is not ready to conceive immediately. Vitrification and cryopreservation techniques. Vitrification is the rapid freezing technique that is used for both egg and embryo cryopreservation. Unlike traditional slow freezing methods, vitrification avoids the formation of ice crystals that can damage cells. Instead, the egg or embryo is frozen by converting the water in the cells into a glass-like state. This significantly increases the survival rates of thawed eggs and embryos. Vitrification involves placing the eggs or embryos in a high concentration of cryoprotectants, which prevent the formation of ice crystals, and then rapidly cooling them in liquid nitrogen. Thawing. After cryopreservation, the eggs or embryos can be thawed quickly and are typically suitable for fertilization or implantation after warming. Advantages and limitations of egg freezing and embryo cryopreservation. Advantages: preserving fertility. Both techniques allow individuals to preserve their fertility for medical or social reasons. Fertility preservation for cancer patients. Both egg freezing and embryo cryopreservation offer options for cancer patients to preserve fertility before undergoing chemotherapy or radiation. Increased IVF success. Embryo cryopreservation allows for multiple IVF cycles with fewer ovarian stimulations, reducing risks and costs. Genetic screening. Embryo cryopreservation can be paired with genetic screening, PGT, to ensure healthy embryos are implanted. Limitations. Cost. Both egg freezing and embryo cryopreservation are expensive procedures that may not be affordable for everyone. Not a guarantee. There is no guarantee that frozen eggs or embryos will result in a successful pregnancy once thawed. Success rates. The success rates for egg freezing and embryo cryopreservation can depend on factors like age, egg quality, and embryo health. Storage time. While embryos and eggs can be stored for many years, the longer they are stored, the lower the chances of success in some cases. Conclusion. Egg freezing and embryo cryopreservation are powerful tools in modern reproductive medicine. Egg freezing offers women the ability to preserve their fertility for medical, social, or age-related reasons, while embryo cryopreservation offers benefits for those undergoing IVF or using donor gametes. Both techniques have high success rates, especially when combined with vitrification, and are becoming increasingly popular options for those wishing to safeguard their fertility for the future. However, it is essential to understand the costs, limitations, and potential risks of these technologies to make informed decisions about fertility preservation.